Dr. Ofer Levy is the Director of Precision Vaccines at Boston's Children's Hospital. He joins me live now. Dr. Levy, thank you so much for being with us. So, in terms of Israel now offering people a fourth shot of this vaccine, I want to get your thoughts on that. Is this going to become like the flu shot, where we're intended to get it every year, or could it be even more frequently than that?
Well, thank you for that, Zain. You ask a really cogent question. And, we're seeing governments around the globe scramble to try to respond to this rapidly spreading Omicron variant. In the state of Israel, I believe they've had several deaths this past week, unfortunately, due to COVID. And at least one of those deaths was due to Omicron. They have an expert panel advising the government there regarding COVID policies. And that panel recommended a fourth booster dose. I have not seen the data, but I certainly understand the big picture as to why they're making this kind of decision, a fourth dose for those who are at high risk.
And what do you make of the head of the World Health Organization essentially saying that if richer countries continue to offer more and more booster shots, a fourth dose, a fifth dose, and perhaps continue to hoard vaccines while poorer countries are left behind, you're essentially going to see a situation whereby the virus continues to mutate and it ends up prolonging the pandemic?
Yes, that is a concern, Zain. And, our Warp Speed initiative here in the United States succeeded in generating safe and effective vaccines in record time. But my one critique of it is it didn't seem to contain strong provisions to provide vaccines across the globe at an affordable price. And this is now really the purview of the world leaders. We need really good multilateral action here to ensure a robust supply of vaccines around the globe. Folks shouldn't be surprised that every country is going to try to protect its population. That's what the governments of the world are supposed to do, and they start by thinking of their own population. But this virus doesn't distinguish by borders, of course. It just spreads and infects, and this one spreads very rapidly, and this calls for rapid, robust multilateral action to have a vaccine plan for the entire globe.
As countries like Israel offer a fourth dose of the vaccine to certain segments of the population, there is a bit of a silver lining here in that it doesn't seem as though there are as many hospitalization cases with the Omicron variant as there is with the Delta variant.
That may be the case. We're hearing anecdotal reports and small reports that Omicron might be less pathogenic, in other words, create a milder disease than the Delta, and that will be welcome news if it's true. But one thing is clear, Omicron spreads very, very rapidly, and more rapidly than Delta. So even if it's, let's make up numbers, Zain, let's pretend, just for argument's sake, that Omicron is 2 times less pathogenic. I'm not saying it is, but for argument's sake, let's say it causes 2-fold less severe disease. But if it spreads 10 times faster, are we better off? In other words, this virus, this Omicron, can fill up the hospital's intensive care units beyond the breaking point.
And just quickly, what do you make of the US now authorizing a pill from Pfizer to treat COVID-19?
Well, this is a very, of course, welcome development. This gives us another tool in the armamentarium. You are, of course, alluding to Pfizer's Paxlovid, which is an oral antiviral medication authorized by the US FDA today for high-risk patients 12 years of age and up. And this is a welcome addition to the armamentarium against this virus, and is hopefully also effective against Omicron. There will be issues here again around production and supply, given the intense global demand. But of course, it is good news.
And the thing is, I want to make it clear to the audience, it's not supposed to replace vaccinations at all. However, is there a fear that some people, especially those who are vaccine hesitant, might see this pill and say, well, listen, I don't have to take the vaccine anymore. If I get sick, I can rely on this pill to help me?
That could be a concern, but let's remember that prevention is an ounce of prevention is worth a pound of cure. Best is to prevent it altogether, and that's with the public health measures and the vaccines. So let's emphasize that. But it is welcome news that there'll be an oral medication for those who are already infected to help reduce the severity of their illness.
All right, Dr. Ofer Levy, thank you so much for being with us.
Thank you, Zain. Always a pleasure.